Hello everyone, my name is Lalit. I'm one of the second year residents in Rosalind Franklin University of Medicine and Science. The topic of discussion today is renal artery stenosis. Renal artery stenosis is pretty common. I would like to directly go into atherosclerotic renal artery stenosis, which accounts almost 90% of cases of renal artery stenosis. So, ARAS is an important cause of malignant hypertension and flash pulmonary edema, especially in the elderly. And as I've written, there's a reported prevalence of 5.5% in CKD patients and can be as high as 7%. But coming to the management, there's been a it has always been a controversial to either go with medical therapy versus stenting. So we have our case is about a patient who is 88-year-old, has past medical history of both systolic and diastolic heart failure, PAD, and diabetes. So she basically presented with hypotensive emergency and flash pulmonary edema. So initially we treated her with diuretics, and she was already on 5 different classes of antihypertensive agents. Um, a month later, she presented again with similar symptoms and again presented with hypertensive emergency and recurrent flash pulmonary edema. So because of that, we had to act on it, and we did a renal artery ultrasound, which demonstrated atrophic right kidneys. So later on, patient underwent a renal angiogram, which showed 70% lesion in the right renal artery, and it was intervened with a bare metal stent. So post-operatively, patient continued to have high blood pressure, worsening renal function, and respiratory distress. She was initially placed on nicardipine drip, and we continued to diurese her aggressively, but as her respiratory distress worsened and even patient was vitally unstable, family opted for a conservative management and hospice was consulted, and patient passed away a week after her second admission. So this is a small figure showing right renal artery stenosis in a patient who has concomitant CHF. So the discussion, as I said, ARAS is a very important cause of resistant hypertension and recurrent flash pulmonary edema, and whoever presents with these symptoms should always be we should always be aware and consider renal artery stenosis as one of the cause. And literature remains scarce on BP management and impact of such treatment on renal function. But there were three randomized, as per the ACC-AHA guidelines, um, they recommend patients who present with flash pulmonary edema to undergo stenting. But there were three randomized controlled trials, double-blinded, comparing various management strategies, especially medical therapy and stenting, which have failed to show any significant benefit in terms of mortality, renal function, or blood pressure control. And there was also a retrospective study which did not show any statistical significance difference between medical group and angioplasty group, and there was only a short-term improvement in renal function, but our long-term need for dialysis was higher. So we we think that renal resistance index, which is calculated during a Doppler ultrasonography, especially in the renal artery, which is stenosed, could be a very predictive tool. And as Radermacher et al. Proposed, there were certain criteria, and if the renal resistive index is greater than 80%, they are very unlikely to be beneficial. So we should be aware of these criteria before considering a patient for optimal medical therapy versus undergoing angioplasty, as this could decrease the procedural risk and also economical burden. And we also propose further trials that needs to be done in order to check the actual benefit from renal revascularization instead of medical therapy. Uh, that ends my slide. Thank you so much.